Well, good morning, everyone. Time for our community calendar, brought to you by First Guarantee Bank, twice chosen as best small bank in Louisiana and in America by Newsweek magazine. First Guarantee Bank. And our guest this morning on our community calendar, we're checking in with Dr. Rob Peltier from North Oaks Health System. Doc, what's on your mind?
I asked if I could come on the radio to ask the public to go out there to visit our local blood centers and donate blood. We really need it now. We're down to critical levels at North Oaks and throughout the South, to be honest with you, especially here in Tejboa Parish.
So people do not give blood at North Oaks Hospital. They can't go there to donate blood. You do it at the blood center, and then they distribute it to you guys. Is that how it works?
That is correct. We pool all our blood throughout almost all of the hospitals in South Louisiana. All the blood gets collected. There's a central unit that understands the needs of hospitals and distributes that blood to try to evenly distribute it to where it's needed. And right now they're just very low, and they can't give us what we need to get back to our par levels. And that requires the community to go out and give that blood.
Is there a certain type of blood, or does it really matter?
Well, for us, for traumas and for acute things, we need O blood, O positive or O negative. O units are the universal donor. We can give it to anybody. So anybody coming in an emergency, I don't have to match that blood. I can give that to them because of the antibodies on it and be relatively safe and not having a transfusion reaction. That being said, we want to make sure we have that supply of all the blood, because some of those units of blood, AB blood, is really specific and can only be given to certain donors. So throughout the system, that donor could be you. Make sure we got our supplies for it.
You said you had some trauma cases this past weekend?
Yeah, well, we're a trauma center. We're a level 2 trauma center at North Oaks, so we get a lot of the entire North Shore's trauma to take care of here. We have a wonderful surgical group that stays on call 24/7, so they come here and even our transfusion protocol, when we have a level 1 trauma, meaning somebody that is seriously ill with trauma, we automatically bring 4 units of O blood to the emergency department to get ready to transfuse it almost immediately when they come in, because it could be life-saving. So, when we get down to 10 and 16 units of that type of blood, we really get concerned, because we can easily use 10 to 20 units on a patient in a single day that's bleeding from trauma, or especially GI bleeds. They tend to bleed a whole lot and very quickly. So we need a lot of blood for those patients, and it really does save lives.
And there could be an accident while we're talking right now.
Unfortunately,
that you need that blood.
Yeah, absolutely. I was on the Blood Center's website this morning. There are plenty of slots where you can schedule an appointment and go give a donation. I donate pretty often, as often as I can, and remember to do that. You could donate every 56 days. You could donate 6 times a year. Only about 10% of the U.S. public actually goes and donates blood, which is unfortunate. We need more people to step up so we have a steady supply. And be honest with you, I told you, Johnny, that I would challenge our local businesses to call the blood center and see about setting up a blood drive, talking to your employees about maybe giving them the ability to take off an hour to go give blood on a regular basis, so that they can we can keep our blood supplies up. I don't want to just fix it for today and tomorrow. Yes, we need that fix right now, but we also need to fix it in the future so we have a regular supply and we never get to these shortages.
So it'd be good to put something on their smartphone to remember to actually remind them that it's time to give blood again.
Absolutely.
And if you give
Johnny.
blood, actually, you can sign up, and they actually send, I get donation requests from the blood centers that it's time, your time has passed to where you've given the blood last time, and it's time to donate blood again. So they can do it automatically once you give blood.
That's right. Listen, my son yesterday, 17-year-old, gave for the first time yesterday. I think he got a ticket to go to one of the local haunted houses as a thank you for a donation. So
they are doing
you may
that.
want to look into that as well, especially our young folks love those kind of things. So encouraging those young, healthy guys and gals to go give blood is great. So I was proud of him for doing that yesterday.
And it only takes, what, 45 minutes total?
It's the blood donation itself. Yeah, walking in to walking out is about 45 minutes to an hour. It takes about 10 minutes to give the blood. They want to watch it for a few minutes. Of course, it takes a little while. You got to go through a questionnaire to make sure that you are eligible. A lot of people, unfortunately, are not eligible to give blood because they've had a chronic illness. They take medications. Any blood thinners usually exclude you because we don't want to give that blood thinner to someone else. I mean, there's a number of reasons that a lot of people can't give. So those people that are eligible to give really need to go do it.
All right. Do it today. And especially as the holidays get ready to approach as well. They're right around the corner.
Absolutely. And one last thing, I'm the COVID guy, so the bivalent vaccine is out. You can get it at either of our Hammond or Walker urgent cares, and so
Ponchatoula too. As well?
We're doing it at Hammond just because of the demand. We're trying not to open vials that we wouldn't use, so we're doing it at Hammond. But there are plenty of slots. So the demand is relatively low. It's very quick, and I know that Dr. Jha, the new White House advisor that took Dr. Fauci's place when he semi-retired, is predicting another little wave. I don't think the waves that we've had before, but is expecting a fall wave of COVID based on some of the new variants.
You're speaking of.
This is a booster. This is the bivalent is a booster for people that have had the first series, but it will protect you from BA4 and BA5 more than the other. I've had multiple boosters, but still when BA5 came out, I got it because it's not quite as good a coverage. This vaccine will give you that coverage.
Will you get that automatically, or do you have to ask for BA5?
You sign up for the bivalent for your booster. That's the booster everybody's given
right now.
It wouldn't make too much sense to get the old booster.
And while you're here, real quick, flu season.
Yeah, it's already hit, by the way. We've had a lot of influenza A hit our area. I would encourage everybody. It's that time, Halloween is the time we push everybody to go get their influenza vaccines. Absolutely go out and get that. Influenza usually hits us harder, and the way that COVID's going right now, yes, we're still losing people to COVID, but we lose a lot of people to flu, especially our elderly population, the similar population that we have with COVID, we absolutely have with flu. So, get your flu vaccine, if not for you to stop you from getting sick, maybe from stopping from passing it on to an elderly grandparent or mother or father that may not survive the flu.
And one last question, can you get it at the same time, the booster and the flu shot?
Absolutely. No contraindication of that. We've done that for a couple of years now. We do know from studies from previous vaccines that you really probably don't want to get more than 3 vaccines in a single sitting because the response goes down just a little bit, but 2 vaccines is fine and you get absolutely the same protection.
Gotcha. All right. Thanks for making it in this morning. We appreciate it.
Thank you for having me.
And again, if you'd like to set up a blood drive, you can actually we have the Blood Center in tomorrow. Matter of fact, coincidentally, Paul Adams will be here with the Blood Center, and he can describe or tell people how they can set up blood drives at their particular businesses.
We have a number of blood drives that happen at our hospital. I talked to Jeff Gyro, our HR director. He's challenging all our managers this year to see which group or which unit can have the highest donation. We're going to shoot for 300 units in a day this time. We usually do 100 to 150. We're going to try to shoot for 300 this upcoming December when we have it.
All right. Well, good luck. Keep in touch.
Thank you, Johnny.
All right.
Thank you.
Dr. Rob Peltier from North Oaks Health System, our guest this morning on our community calendar being brought to you by First Guarantee Bank.